So my name is Simon Sherry, and I work in the research area of medical imaging. And so the way I got into this was that as a high school kid, I loved astronomy. And I also loved physics too. And so I did my undergraduate degree in physics and astronomy. And after that, I was trying to figure out a way I could use this physics to do something useful. And I learned about the field of medical physics, where you apply physics to problems in medicine, particularly in imaging, being able to diagnose disease in the body, and also in therapy, being able to use the principles of physics to treat disease. So that's how I got into the field of medical physics and medical imaging, and I've had a wonderful career in this field ever since then. Yeah, so I think this is probably the most exciting project in my career. It took over 20 years to come to fruition. It was the concept of building the world's first medical imaging device that could really see the whole human body at once. And the motivation for this was to allow us to collect a lot more signal from the body when we're imaging, allowing us to collect scans more quickly, with lower radiation dose, but importantly of higher image quality, with the premise that we'd be able to see earlier stages of disease and really quantify that and guide treatment for patients. Yes, my laboratory has been funded by the National Institutes of Health for over 30 years now. And it's funded broadly our programs to develop new sensors, new electronics, new computational methods in imaging, and then, importantly, applications of imaging in clinical research as well. And so NIH funding has been absolutely critical. It's supported essentially all of our work, from fundamental detector technology development, new detector materials, new electronics, assembling that into prototype systems, and also in training the next generation of imaging scientists. Another very important part of federal funding is the graduate students and the young researchers that get to participate in this cutting-edge research. The big challenge if we lose federal funding in this field is that the development of cutting-edge and innovative technologies will suffer. Because before you can translate these to industry, you have to develop initial proof of concept. And that's a very risky endeavor, which companies generally will not invest in long-term technologies, and so that has to be done in the academic setting before it can be transferred to industry. And that's where the federal funding is absolutely critical. Well, essentially all the advances you've seen in medical imaging over the last several decades have come one way or another out of federal funding, either directly to academic labs or through small business grants to startup companies. So the role of federal funding in enabling these new imaging innovations is critical. And that's important to the patient because these new imaging innovations allow us to see inside the body more clearly, diagnose disease more accurately at an earlier stage, and they also play a huge role in clinical research where we try to better understand the disease process inside the human body.